Hey guys, welcome to my video. In this part, I'm going to talk about the mammary gland anatomy of part 2. Like in the part 1, we have discussed about the structure of the breast and also the introduction. So here in this part, we'll be discussing about the blood supply, nerve supply, lymphatic drainage and clinical anatomy. So let us go into the blood supply. Here in the blood supply of mammary gland, we have both arterial supply and venous drainage. So first we'll be saying about the arterial supply. Okay. So in this arterial supply, we have internal thoracic artery, branches of axillary artery, and lateral branches of posterior intercostal arteries. So these are the arteries which are giving the blood supply to the mammary gland. So in this internal thoracic artery, this is a branch of subclavian artery. Okay, see the branches of internal thoracic artery. So here, these branches are coming from the internal thoracic artery. So these are the branches supplying the mammary gland here. And coming to branches of axillary artery. Here, this is the axillary artery, and these are the branches of axillary artery. Superior thoracic artery, acromiothoracic artery and lateral thoracic artery. These are also supplying the mammary gland. And the next one, the lateral branches of posterior intercostal arteries. Here are the branches of posterior intercostal arteries. So these are also supplying the mammary gland. This is the arterial supply. Coming to venous drainage. Here in the venous drainage, all the veins follow the arteries. So here there is an axillary artery. So you can also imagine there is an axillary vein here. So likewise, imagine like that, okay? So here, firstly, at the base of the nipple, here, all the veins forms an anastomosis, forms a venous circle there at the base of the nipple, from where it runs into superficial as well as deep veins, okay? So here it is dividing into superficial and also the deep veins. In the superficial veins, the blood it drains into the internal thoracic vein and into superficial veins of lower part of the neck. So, internal thoracic vein. Here we have seen internal thoracic artery branches here. So, also imagine there is an internal thoracic vein here. Okay. So, coming to deep veins. Here the blood is draining into the axillary and posterior intercostal veins. Here we have seen axillary artery. Imagine there is an axillary vein here. Okay. So here the blood is draining into the axillary vein as well as posterior intercostal veins. I hope you all understood this. So let's move into the next. I'll show you here in this image. See here, this is the axillary vein and this is the axillary artery. From here, we can see the deep veins running here into this, as well as axillary artery here, where we can see its branches here. And this is the internal thoracic artery, and this is the internal thoracic vein, and its branches also you can see here. Okay. So next topic is nerve supply. The mammary gland is supplied by the nerves, which are the anterior and lateral cutaneous branches of 4 to 6 intercostal nerves. So from these nerves, give its sensory fibers to the skin and its autonomic fibers to smooth muscles and blood vessels. Okay. See, these intercostal nerves gives its sensory fibers to the skin and its autonomic fibers to smooth muscles and blood vessels. And here it does not control the secretion of milk, because the secretion of milk is controlled by the hormone called prolactin, which is secreted by pars anterior of hypophysis cerebri. I hope you all got this. Coming to next topic, lymphatic drainage. Here the lymphatic drainage can be briefly described under two headings, lymph nodes and lymphatic vessels. First we'll see the lymph nodes here. Yeah. Lymph from the breast drains into some lymph nodes. Okay. So here we have three types: axillary lymph nodes, internal mammary nodes, and some other lymph nodes here. First we'll see what are axillary lymph nodes. Firstly, in the axillary part, like here this side, the most of the lymph is drained into the anterior group of axillary lymph nodes. And we have posterior, lateral, central and apical lymph nodes also. But the most of the lymph is drained into the anterior group directly. And into some other groups like posterior, lateral, central and apical, it receives the lymph either directly or indirectly. Okay? Next, coming to internal mammary nodes. These internal mammary nodes lie along internal thoracic vessels. You can imagine, like we have seen previously, right? There are some vessels here, blood vessels, for both arteries and veins. So these lymph nodes also lie along with them. And next one, coming to I told you some other nodes here, right? So some lymph from the breast also reaches the supraclavicular node, the cephalic nodes, posterior intercostal nodes, the subdiaphragmatic nodes, and subperitoneal lymph plexus. Okay, so I hope you all understood this lymph nodes. Next one, lymphatic vessels. So here the lymphatic vessels, it is of two types. Okay, superficial lymphatics and deep lymphatics. Here superficial lymphatics, it drains the skin over the breast except for nipple and areola. Here in deep lymphatics, it drains the parenchyma of the breast as well as the nipple and areola. So here just remember that superficial lymphatics drain the skin, deep lymphatics drains parenchyma. Here superficial lymphatics does not drain nipple and areola, but deep lymphatics it drains both nipple and areola. So I hope you all got this lymphatic drainage. I'll give you a summary. Here the lymphatic drainage, it have two types. It have two headings, lymph nodes and lymphatic vessels. So in the lymph nodes, you have three lymph nodes: axillary lymph nodes, internal mammary nodes, and supraclavicular, cephalic, posterior, intercostal. These are the nodes. Okay. So in the lymphatic vessels, you have two: superficial lymphatics, deep lymphatics. In superficial lymphatics, it only drains skin. In deep lymphatics, it drains both parenchyma of breast as well as the nipple and areola. Got it? So, next topic is clinical anatomy. Yeah. Like in the clinical anatomy, we are all known about the common thing called breast cancer, right? Carcinoma means cancer. So, here in the clinical anatomy, the very known clinical feature of the breast is breast cancer. So carcinoma means cancer. Breast cancer is most common invasive cancer in women, and it is the second leading cause of the cancer death in women. And the first leading is always the lung cancer. So here cancer of mammary gland is very commonly seen in females of all ages, but most frequently it is seen in postmenopausal females because they have the estrogen hormone very less comparatively. So the most frequent site where this cancer occurs is upper lateral quadrant. In all the quadrants it occurs, but the higher rate is in the upper lateral quadrant. Okay, so we'll see how it is spreading over the breast. Lymphatics is the common thing which spreads the cancer in the breast. Like, see, communications of superficial lymphatics of the breast across the midline. Cancer may spread from one breast to another. So the lymphatics communicating across the midline from one breast to another. So here the cancer is spreading from one breast to another. Likewise, because of the communication with those of abdomen, cancer of breast may spread to liver and cancer cells may drop into pelvis also. Okay, so next thing, obstruction of superficial lymph vessels by cancer cells may produce edema of skin giving orange color appearance. Obstruction is nothing but blockage. So when the lymph vessels are blocked by the cancer cells, some edema is produced in the skin. We know edema is kind of swelling. Is produced in the skin where it gives some kind of orange color appearance to the skin. Okay. So here, apart from lymphatics, Cancer cells may spread from segmental veins because the veins draining the breast have a communication with vertebral venous plexus of veins. So when there is when there are some cancer cells in the breast, it is easy to spread into vertebrae and brain through these segmental veins. Okay. So next one, self-examination of breasts. Here, the self-examination of mammary gland is the only way for the early diagnosis and appropriate treatment. So how we are going to self-examine it? Firstly, you have to inspect the symmetry of the breasts and nipples, whether both are the same for both of the breasts. And next one, you have to see the change in color of the skin, if there is any change or not. And the next one is retraction of nipple. Here, retracted nipple is a very good sign of tumor in the breast. So, it will tell you if there is any cancer or not if you are examining it. Next one, discharge from nipple on squeezing it. And here, palpate all four quadrants with the palm of the hand and note if there is any palpable lump. Lump is like some accumulation there. It will feel like some hard. It is not soft. So when you palpate it, if you find some palpable lump, that is also a sign of cancer. Okay, these are the self-examination tests for the breast. Next one, mammogram reveal cancerous mass. Here, mammogram is nothing but a kind of X-ray. It is an X-ray which reveal if there is any cancerous mass inside it. Okay, so next one is fine needle aspiration cytology. Here, fine needle aspiration cytology is a kind of biopsy where a needle is sent through the skin inside the breast into the breast, and from there where some cells or fluid or some tissue is taken out through that needle and sent to the lab for microscopic study. So which is a quick method of diagnosis of lesion of breast. Okay, so it helps in studying the breast cancer if it is there in your body. So these are the clinical anatomy. I hope you all got this, and I'm here to tell you that what all the topics I explained here are very important for both examination purpose also, like for all the physiotherapy students especially. So you can add all these points are very valid. So you can add all these points to your exam. So study all the things what I explained you, and thank you for listening. If you like the video, please like, subscribe, and comment if you have any doubts. We'll reply you. Thank you.